On sick days, it's important to know that you need to check your sugar levels more often and also not skip the insulin, because insulin is very much required in order to prevent the ketone bodies to be generated. So what you should do is, if at all the amount of carbohydrates that is being consumed for that meal is less than usual, you can reduce the dose of the rapid acting insulin or the bolus insulin. However, your insulin should not be skipped unless the meal is entirely skipped. It's important that you check your sugar levels at 2 to 3 hourly intervals on those days, as when your sugar level is on the higher side and ketones are there, you can give a smaller dose of insulin at frequent intervals in order to bring down the sugar levels to normal, which will again make the ketones disappear. This way you can prevent diabetic ketoacidosis or DKA. Let me tell you something about what to do on days of physical activity when it is intensive or prolonged. You should always check your sugar levels before you go to exercise, so that you know if your sugar level is on the borderline lower side, then you can have a small snack of complex carbohydrates in order to bring your sugar levels up during the whole activity. When your activity is prolonged, physical activity is prolonged, then you can also check your sugar levels in between ones in order to correct it if at all it is on the lower side. On days of excessive physical activity or intense physical activity, it's good to also check sugar levels once in the night, because there is a chance of delayed hypoglycemia which can occur late in the evening or in the night as well. If you take these small precautions when you're exercising intensively and for a prolonged duration, you can do whatever physical activity you want to do, and you can do it well without any hindrance. So it's important to follow these rules in order for your child to have a good health during these times of physical activity as well as sick days.